At meron pa tayong isa pang flash report mula naman sa Cebu.
Super Radio Flash Report!
Nako, dengue po ito dyan sa lungsod ng Cebu mula sa DYSS Super Radio Sugbo.
Idiniklara ng Cebu City Health Department ang dengue outbreak sa 25 mga barangay dito sa Cebu City. Ilan sa mga apektadong barangay ang Kalubihan, Cogon Ramos, Santo Niño, Bakayan at Sambag 1. Sa talaan ng Regional Department of Health, 25 katao na ang namatay dahil sa kagat ng lamok simula noong buwan ng Enero hanggang ngayong Hulyo sa kasalukuyang taon.
Every year, the dengue virus has infected thousands of people and claimed the lives of hundreds. Despite existing efforts to control the spread of dengue virus, deaths and infections continue to rise. Because of this alarming health incident, the Rotary International District 3860 took action and initiated a campaign to intensify the eradication of the dengue virus through larviciding method as a support to the government's efforts on dengue eradication. The campaign was spearheaded by a Rotarian and a neurosurgeon based in Cebu City, Dr. Wyben Briones. With his passion and dedication, Dr. Briones formed a movement together with his fellow Rotarians and the Cebu Medical Society. It was called the Dengue Free Movement.
The dengue movement started back in the year 2010 when Cebu at that time had a very big problem regarding the number of dengue patients we had. Every hospital was having their dengue lane and dengue wards. We hear of so many members of our families stricken by the disease. So it was really very alarming. So us in the civic organization sector, specifically the Rotary organization, we also gathered together and asked ourselves how we can help our health authorities. So we went to the Department of Health. The regional director then was Dr. Susana Madarieta, and asked her how we can help as an organization. So that was the start of the dengue-free movement.
Dr. Briones was determined to protect the lives of people by looking for solutions to the dengue virus. He researched on the different methods other countries use.
Before we went to the Department of Health, we researched first. I went into the internet and researched how other countries were handling or were taking care of their dengue problem, and came up with the paper in the internet that described the WHO World Health Organization sponsored Temipos or larvicide campaign in Thailand. That was really the start of the information that we had. That was the source of the information that we had, in which we were able to replicate their methodology in the control of dengue.
According to the research and trials, Temifos has a low toxicity for mammals with long-term effectiveness to kill mosquito larvae. In the absence of a safe and effective vaccine against dengue, studies showed that vector control is the most effective method to prevent the spread of the disease at present.
So, the principle there is really prevention. You kill the mosquitoes, which is the carrier of dengue virus, before they even are transferred to another patient. That's the principle. But how to do this is do it simultaneously and do it during the time when they are breeding. So when is that? It is start of the rainy season and all throughout the rainy season. So the month of June, July, August, which are really the months that mosquitoes multiply. So that is also the time that larviciding should be done extensively.
The first phase of larviciding campaign took off in October 24, 2010, and was simultaneously done in 20 selected barangays with the high dengue cases in Cebu City.
So we had pilot project of 20 barangays in 2010. It expanded to the whole Metro Cebu in 2011, and it became a mid-section Cebu from Carmen up north to Sibunga and as far west as Toledo in 2012. So that was the mid-section drive.
In 2013 and 2014, during the fourth and fifth phase of the larviciding campaign, the Department of Education joined the movement.
So the plan was to apply the larvicide in population centers in all of the towns, cities, and barangays of the whole province, the whole region, in fact, the whole region 7. That was our objective. So in August 17, there was a region-wide application of the larvicide Temepos all over the Region 7, as well as all 2,300 schools of the Department of Education. So that's in summary is the dengue drive.
In 2014, the Department of Health in Region 7 reported that dengue cases dropped by around 80% compared to 2013.
We were fairly successful in bringing them down, the statistics. In fact, during the report during the dengue season was that we were able to decrease the incidence of dengue from the very high incidence in 2013 to a low of 65% less in 2014. In some of the regions, in some of the towns, they were reporting 81% less than the incidence last year.
So with this program, I am very proud as the mayor of the city of Cebu, also responsible in addressing health concern that there is the existence of a program Eliminate Dengue as a challenge by the Rotary International, and they call it Dengue Free Movement. And it by statistic, you can always have seen at one time so high, then it went down. And that is from 2013 to December 2014. And looking at these figures will never lie for being an institution helping address the problem, the dreaded ailment called dengue. Even have been given an award by the city government in a Charter Day celebration.
we plan to continue. No? We plan to continue the drive. The battle or the fight against dengue is not yet over. It's not yet finished. In fact, we have just started this movement. 5 years of movement showed us good results. But if you loosen your drive, if you decrease the intensity of our drive, dengue will come out again. So the fight is still beginning because nobody else is doing this. So it should be us. It should be the community who should do this.